All right, everyone, let's just continue from here. We were talking about assessment recommendation regarding the intellectual disability. When we are talking about the intellectual disability, we have talked about adaptive functioning. We have talked about the intellectual functioning. Let me give you another information regarding the intellectual disability. That is, when we are talking about the intellectual functioning, that basically comprises of two domains. Am I being very audible to everyone? All right. So when we are talking about the intellectual functioning, we actually have to think about the two basic paradigms. The first one is the type of fluid intelligence, and the second one is compact intelligence or the crystallized intelligence. All right. When we are talking about the fluid or the analytical abilities or intelligence, that is basically the regarding the pattern analysis, copying, matrices, the abstract task. Okay, like performances, like your basic practices. Okay, when we are talking about the crystallized intelligence or the crystallized abilities or the compact abilities, we are actually talking about your academic skills, your learning abilities. All right, that comprises of two versions, verbal or the quantitative. Okay, verbal skills of your academics include vocabulary, your comprehension, your um, uh, verbal relationships, right? Like your information, your digital span, your arithmetics, your comprehension, your similarities, or the differences measurement. All right. When we are talking about the crystallized intelligence part of quantitative reasoning, we are actually talking about the quantity, numerics. All right. The series, equation building. All right. So when we talk about the intellectual functioning, we also have to group the test in these two versions as the fluid intelligence batteries and the crystallized or the compact intelligence batteries. All right. The part of those tests or the group of those tests that comprises of your pattern analysis, that is regarding the abstract reasoning, all right, that is regarding the problem solving, all right, that basically are the fluid intelligence batteries. Okay, so these batteries actually, for example, if I have to name about the common practices in my native country, the Pakistan, then I would say the fluid intelligence batteries include CPM, Bender-Gestalt test, SPM, standard progressive matrices, and TONI, test of nonverbal intelligence. All right. Same like if I'm talking about the crystallized intelligence batteries, the batteries which are regarding your comprehension skills, which are regarding your academic learning, which is regarding your verbal reasoning, your quantitative reasoning, then I am talking about the WISC. Then I'm talking about WAIS in case of adults. Then I'm talking about SIT, Solution Intelligence Test 4, all right? Then I'm talking about RAT, Wide Range Achievement Test, all right? Same like that, we also have to encounter the neurophysiological test about the neurological behaviors of the person. All right. For these assessment, we have these particular tests normally practiced in our native culture. As I have told earlier, that intellectual assessment requires your personal assessment, your clinical assessment. All right. That require a standardized assessment tool. And the third thing is cultural-based assessment. So we are here talking about the wide range of culture-based or the worldwide normally practiced assessment tools in the intellectual disability, okay? So we have BGT, Bender-Gestalt test, QNST3, and SVMPT, All right. Normally, QNST and SVMPT are also not being very in practice particularly, but the Bender-Gestalt test is far more practicable in Pakistan rather than other than groups. All right. Okay. When we're talking about the adaptive functioning, then we are normally, as we have discussed earlier, we are normally talking about the individual daily living practices. All right. So here we have certain scales, certain assessment recommendation in case if you're practicing in Pakistan or in certain culture prone environments. Then it's wide range adaptive behavior scale, OSMS. All right. I have mentioned the age ranges as well. All right. Portrait guide for the early education is frequently being practiced here, but unfortunately, being a practitioner, I am not in a very good recommendation of that particular guide because it's not actually an assessment tool. It's just a guideline for creating an individualized educational plan. All right. So that can be for the purpose of special education, but that shouldn't be used for the diagnosis purposes. All right. So next comes the psychopharmacology for the intellectual disability. All right. As we have discussed earlier, normally intellectual disability in case of severe or the profound have some kind of co-occurrences, right? Have some kind of, you can say the comorbidity, right? So in case if a patient is having some kind of like aggression and self-harm or the explosive temper, as we have talked in the severe level of intellectual disability, then normally atypical antipsychotics, anti-epileptics, mood stabilizers are recommended if a person is along the conduct disorder and intermittent explosive disorder. All right. Let me tell you, sometimes, as we have discussed, conduct disorders are not being very diagnosable at the age of 5, obviously, but over the period of time when the intellectual disability is being diagnosed with the comorbidity of such disorders, then these medicines will be usable. All right. That normally is risperidone, olanzapine, aripiprazole, all right, valproic acid. So these are few medicines, fluoxetine and citralline, lorazepam, that is normally used when the intellectual disability is being comorbid with the panic disorder, with the certain phobias, or the patient is having some kind of severe anxiety. Then in that case, that is a very recommendable dose. All right. So as we have discussed, intellectual disability comes with some kind of behavioral issues over the period of time. So that's why this is the whole medicational curriculum I have shared with you guys. You can go through this as far as you want to understand. These are the symptoms cluster along with the intellectual disability. Here we have a probable diagnostic categories for that. Okay. Then here come the order of applicable drug class. These are the drugs, all right, for the psychiatrist they would recommend. These are those drugs classes, or you can say the groups that would be considered. Okay. Here comes the management in the intellectual disability. All right. As we have discussed earlier, psychopharmacology is used or is important for us to study is because when we are taking a case report, when we are having the prescription of the prior or recommender or the practitioner, then after just looking at the patient, or you can say the clinical interview, and after studying the prescription, or you can say the RX form, you should be able enough to understand after the medications that what kind of probable issue a person would be having or a person is actually facing. All right. Rather than you are just taking a whole history from the informers, like from the beginning till to the end today. All right. That suffocates them actually. So here comes the management in the intellectual disability. That is actually the overall practice you can perform in case of intellectual disability. All right. First, you have to observe, you have to record the behaviors of the person. All right. Then target the negative behavior needed to be changed. Okay. Choose your approximate recording method. Choose your approximate, you can say, the alternative method to be used for altering the behavior. Okay. So the first thing is applied behavior analysis. That is a very major practice. All right. I can't actually explain it in like a whole bunch of course in just this course in one class, but rather than I would recommend these whole things. All right. You can use applied behavior analysis in regard of reinforcement to boost a positive behavior, which is actually very negligent in the person, but is present in that case. If a client is having a kind of behavior that shouldn't be there, all right, or you want to minimize that behavior, then you can use a punishment, all right, by exterminating a positive stimulus or by adding a very negative stimulus. That are both the categories of punishment, right? Then it comes to the extinction, where you can use stimulus generalization and stimulus discrimination as a method to actually eliminate that particular negative behavior. All right. Then comes to the shaping. That is actually about creating a behavior in a person that was not actually entirely there. Now you have to entirely create that new behavior in that particular person. All right. Then it's called shaping. And that would require a very specific, consistent patterns of steps over the successive approximation over the period of time, then it would create that particular behavior. So it's called shaping. You are actually shaping a behavior in a person, right? Then it comes to the transfer stimulus control. That is the fading. That is also a very discriminating term for the extinction. But here you are actually transferring the control of stimulus to another stimulus. All right. If you want to actually exterminate a behavior and you have indicated the stimulus, you can simply work on the stimulus and exterminate that particular stimulus. All right. Destimulate that particular stimulus is fading. You are transferring that particular initiation to another stimulus. All right. Then it comes to the chaining, that is the task analysis, right? Then it comes to another group of, you can say, a bunch of protocols you can have in case of management for the intellectual disability. That includes the self-management, where actually over the period of time when a patient is actually facing intellectual disability with the mild or the moderate level, then in the adulthood, they can enroll themselves in a self-management program where actually making decision to engage in self-management, all right, and then defining the targeted behaviors or, the competition behaviors to the practitioner, that would be their initiation, all right? They will set the goals along you, they can self-monitor that goals, and then over the period of time you would have to conduct a functional assessment, all right, along that person. He will be collaborating with you, all right? In these particular self-management plans, actually these are developed to make them more self-dependent, or you can say more self-dependent, and actually more socially responsible for themselves. All right. So they will evaluate the change. They will actually reevaluate the self-management strategies over the period of time when they are having this kind of program. All right. Then it comes to the habit reversal protocols here. Actually, if the individual or the adult is having an intellectual disability with the very mild, or you can say a very moderate level of problem, then they would acknowledge their negative habits, all right, and they want to change that habit for their loved ones, okay, and they will enroll in these protocols, all right. Then it comes to this token economy. That's a kind of play therapy as well, and you can practice them with the children, where you can actually work or you can actually manipulate them with the reinforcement along the token economy. All right, and that will actually boost their positive behaviors. Then it comes to the behavioral contracts and the skill training programs. In the skill training programs, actually, they are, as we have discussed earlier, being a psychologist, we have to acknowledge that this is the disorder that needs a management with a patient, right? So the skill training programs are basically our evidence of being patient, right? So here you would actually create certain training programs, certain individualized training program where the person would actually indulge to learn particular skill. All right. Then it comes to the problem solving strategies. Here, the individual will enroll themselves, or you can say they would initiate to make certain changes with their sole responsibility. All right. So basically, these are certain practices that are needed over a period of time, and they will obviously need ourselves for better activity and responses. I hope today's lecture was very much informative for you guys. So lecture will be uploaded in the YouTube channel. That is the Science of Psychology. You can approach it there. You can like, subscribe, and share it. And in case if you have any query, feel free to contact me. Thank you, and have a good time ahead. Allah Hafiz.